Good morning, everybody. Yeah, my name's Christine Samuel, and I'm the Rheumatology Occupational Therapy Clinical Lead in Swansea Bay University Health Board. And today I'm going to present to you my project under the Bevan Exemplars scheme. Sorry, my voice is going to go, which is about enabling occupational therapists to use a cognitive behavioural approach. So by way of background to the project, this stemmed from seeing patients in our service, for example, with fibromyalgia, who struggle not only with the symptoms such as chronic pain and fatigue, but also experience a range of distressing emotions such as low mood and anxiety. They tend to have poor coping strategies, and therefore engaging in self-management can be difficult or sometimes impossible. Occupational therapists use their skills so they look at a person holistically. They consider the person's physical, psychological, social and environmental needs. We have dual training in mental health and physical health. And those therapists who work in a physical setting can deliver basic interventions to address mood and anxiety. However, traditionally, CBT is the domain of mental health services. So being able to acquire skills to use a CBT approach in a physical setting would be innovative. And enable OTs to work with patients to improve their coping strategies. I should emphasise we were never intending to be CBT practitioners, as this is a much longer training. Our intention was to use the techniques alongside our normal interventions. With respect to prudent healthcare, being able to use a CBT approach would mean that with some patients there could be an improvement in continuity of care, as the therapist would not need to refer on, for example, to mental health services. It could improve patients' abilities to engage in self-management, as it would improve their coping strategies. It would also comply with the evidence-based recommendations for the use of non-pharmacological treatments, for example, the NICE guidelines for chronic pain and the European League for the Prevention of Rheumatism's recommendations for the management of fibromyalgia, which advocate for using CBT. The overall aim of the project was to enable occupational therapists who use self-management principles develop a set of CBT-based skills and to incorporate these into everyday practice. So the project began with us identifying a suitable course, which was aimed at AHPs. The course comprised of an initial 2 days training followed up by 2 follow-up days. And we managed to source a trainer who is a very experienced CBT practitioner and has extensive experience in training healthcare staff in a variety of health settings. We were very fortunate quite soon into the project to gain funding for the training from the Bevan Legacy Fund, which is based at Neath Pataba Hospital. And the course that we identified aimed at giving participants a greater understanding of the role of CBT, of the role of a CBT approach can have in reducing and managing distress, anxiety, panic and depression. As the tutor was able to offer training to a larger group than just the rheumatology service, there are 5 of us in our service, we were able to open up the training to 13 therapists who work in self-management in various physical settings. So this is our first training day, which was the only one which was face-to-face. And we had therapists from pulmonary rehab, cardiac rehab, oncology, pediatrics, pain management, the therapists in my service, and also 2 therapists from Hawldda and Cwmtaf, wellbeing and primary care. So prior to the training, I gauged the therapist's knowledge of CBT using an evaluation form, and the questions that we asked were whether they had some prior knowledge to rate their confidence in using it with patients, in interventions, awareness of how CBT can benefit patients and improve outcomes, and rating the relevance of CBT to their clinical area. The evaluation was repeated at each stage of the training. So the 2-day course commenced in February 2020 and was followed by 2 one-day sessions, which were supposed to be April and November. And in between training, the therapists were asked to put into practice the techniques that they'd learned with patients and to provide evidence to the tutor, so that could be just discussed at the next session. And we know what happened in March. So this presented us with obviously very many challenges. But the biggest was the majority of the therapists were redeployed to wards and therefore not able to use their CBT skills in this area. However, the project did resume momentum in August 2020, when some of us had gone back to our normal posts. Some therapists had been able to use their skills, but not as extensively as had been originally planned. We finally completed the second training day in November, virtually this time. But then, of course, lockdown came again, and again, some therapists were redeployed or their services operated at a reduced capacity. So it's been a stop-start throughout throughout the year, and the last training date finally took place in February, just not that long ago. Okay, in terms of, we have managed to do quite a lot despite all the challenges, but the project hasn't obviously progressed as far as we would have wanted in demonstrating patient outcomes. But we hopefully will be able to do this now over the coming months as we're all back in our normal posts. We've managed to train 18 occupational therapists working in 8 clinical areas, and this has led to a system improvement in these clinical areas. Therapists are now familiar with various cognitive techniques to enable them to adopt a CBT approach in their different clinical areas, and their knowledge has increased on an average of 0.5, and in some cases the increase was greater depending on the therapist's previous knowledge. The confidence of the therapist has definitely increased, and that's backed by the same figure, about 0.5. And for those therapists who did remain in their normal post, it was greater as they had the possibility to practice their newly acquired skills. Therapists are now able to detect with greater sensitivity those patients who would benefit from a CBT approach and those patients who require more specialist input from mental health services. In terms of value for money, the training cost the equivalent of £242 per therapist, and based on potential delivery to the patients in our service, for example, for last year we had 207 patients were referred who had fibromyalgia, and if you break that down, that would be the equivalent of £71 per patient. I mean, not all of them would have had, had the approach, but that's roughly a little summary. So I just wanted to give a little case study, which is one of the participants who from primary care who participated in the training, which I think demonstrates quite nicely how we, some of us have used the approach. So this patient was referred to our primary care OT by a pharmacist due to pain, anxiety and issues with transfers. Her presenting condition was a diagnosis of osteoarthritis, and during the COVID lockdown, her pain had increased for no obvious medical reason, and medical investigations had identified no cause for concern as she was waiting to be seen by the pain team. She was requesting more analgesia, and however, this in turn made her feel drowsy, constipated, and she was spending more time in bed. So in terms of the interventions that the therapist carried out, There was a discussion about mood, using lots of Socratic questioning, which is one of the CBT techniques we learnt. She completed the hot cross bun model, as it's called, which is another CBT technique where you test out a situation in which a problem arises and see how it links to physical sensations, emotions, behaviour and thoughts. She then discussed the possible connections within the hot cross bun. The patient made the link that spending more time in bed could be making her weaker and therefore increasing pain and anxiety. But she was worried by doing more, it would make her pain worse. They spoke about the patient completing a diary to look at pain and symptoms, which was carried out. And at a later date, the therapist reviewed the patient's diary via telephone. The patient discussed what she'd noticed, and the diary highlighted times she was in less pain when she was out of bed, watching Strictly Come Dancing, speaking on the phone to friends and making food, so engaging in activities. So by way of reflection, the therapist commented that she found the use of the hot cross bun allowed the patient to become engaged and activated. She was able to generate her own reasoning into how her emotions and thoughts were impacting on her physical symptoms and then behaviour. So in terms of next steps for the project, we are actively consolidating the skills that we've learnt, and we want to continue building our confidence in using them with appropriate patients. In my particular service, we're definitely trying to embed the skills into our service delivery, and the other therapists in different teams, you know, they're trying to do the same, I hope. We're exploring and developing supervision pathways, and this might be through peer support. And we will have one final supervision session with the tutor later in the year. We plan to develop closer pathways with mental health services to ensure a smoother transition of patients. And we hope also to be able to evaluate patient outcomes where we've used the approach by using, for example, the patient health questionnaire or the general anxiety questionnaire. So just to somehow sum up how it's been being part of this brilliant experience, it's been invaluable, and I would definitely recommend it to others. It's enabled me to try something new, and I've met professionals from all over Wales in the networking events, and I've been able to attend some workshops with really, you know, experts in their field, which has been excellent. So just to conclude, I want to thank the Bevan Legacy Fund at Neath Pwllgwyngyllgogerychwr Hospital for the funding, because it wouldn't have happened without them. I'd like to thank the staff at the Bevan Commission for keeping my spirits up when I thought the project was floundering, and there was a few of those occasions when I had conversations with Sean and also Nick Ritchie as well. I want to thank the inspirational training from our CBT practitioner training, Kathy Byrne, and also the therapists who participated in the training for their commitment and ongoing enthusiasm for the project. I know a few of them are here today, so thank you very much.